Good morning, everyone. Thank you for joining us today. And today we are thinking about coming back, going back to school. I'm not going back to school, but I know lots of other people are going back to school. So today with me, I have one of our public health nurses and SRG epidemiologist, Jenni Horecny, whom you've met before. Jenni does a lot of work with education, a lot of things that have to do with children and young adults. So we decided to ask her to come today and tell us a little bit about what are we doing, what's happening. So thank you for joining us, Jenni. So tell us a little bit about what is it that SRG and you do to partner with the schools in the area.
Yeah, that's a great question. As a former school nurse and a mom myself, I know that it's really important to stay in contact with schools because that's a lot of times one of the first places where health issues are identified in children. So we work closely with schools to monitor illness trends and help them when there are outbreaks of things like flu or chickenpox or gastrointestinal illnesses. We help provide guidance to school nurses and leaders to help decrease the spread of illnesses and talk about when kids need to stay home and when it's safe to return. We also help partner with schools to encourage and support families getting their immunizations. We have a great immunization program here that helps support school-based clinics. And we also provide training and resources to our school partners and give them updates about illnesses we're seeing in our community so they're ready to respond and also help answer parent questions.
Wonderful. And I do know that you and the team meet with a defined frequency with like the school nurses. I spend some time with the superintendents because we do believe K through 12 is very, very important for many, many reasons. That's where the next generations are.
Absolutely.
And we do our best to work with them proactively. And we do have to say thank you to our K through 12 and our higher education partners. You know, Spokane, a lot of higher education institutions. We work very, very closely with them. I was actually talking to a couple of them yesterday about something unrelated. Of course, measles came up.
Sure.
Because everybody has seen our press release about the exposure and the fact that we have a presumptive case in the region. Can you tell us a little bit about where are we, what can we do, what can people should be thinking about when they hear that?
Yeah, that's a good question. So right now we have 2 confirmed cases in Idaho.
Right.
One in Kootenai County and one in Bonner County. There were some exposures here in the Spokane area, and we've notified folks about that and are working with them. We also have a local resident who had a high-risk exposure and is having symptoms consistent with measles. So we're working with that family, monitoring that situation very carefully. But what families, parents, caregivers can do right now is take a look at your own immunization records for yourself and your family. Make sure that children and adults are up to date on their MMR vaccine to cover for measles, mumps, and rubella. Usually that first dose is given around 12 to 15 months and a second dose around 4 to 6 years of age, so right before kiddos are starting kindergarten. So making sure that you're up to date with that because those 2 doses will provide over 95% protection against measles infection. Another thing we can do is have people be alert for symptoms. Measles usually starts with what we call the 3 C's, cough, coryza, which is a runny nose, or conjunctivitis, those pink watery eyes, a high fever, and then that classic rash that starts on the head and moves down. So monitoring for any of those symptoms, especially if you were at any of those exposure locations of people that we've been working with. And then if you do have any symptoms and you're concerned about measles, be sure to reach out to your healthcare provider and give them a call before just going into the clinic or the emergency department. We want to make sure that precautions can be taken to protect others around you as well. If there's a concern, it could be measles.
Actually, you made a couple of really, really good points that are important for people to remember. So I do know that our team and the communications team, we have on our website, you can go there and look at the measles outbreak page. All of the information is there. Anything and everything you need to know is there. So if you have any questions, go there first, take a look. If you have any symptoms or anyone around you has any symptoms or you have concerns about potential exposure, call your provider. And the reason why I say call your provider is if you kind of run into the urgent center or the doctor's office and you may have been infected, that's highly contagious, so we try to avoid exposure. Now, our healthcare partners want to reassure everyone that they have all of the appropriate precautions in place to prevent as much as possible. And of course, if you have an illness or symptoms that require an emergency room visit, by all means. We're not saying you don't go. We're just saying if you just have the runny nose or the cough or you're not sure, message your doctor, pick up the phone, email them. I think nowadays we can connect very easily before you go, and they will advise you the best way for you to get access, also the best way to protect everybody else that may be there. So with that, let's move a little bit away from measles, because as you mentioned, one of the things we do is work with a lot of diseases. What are things that parents should be thinking about as we think about going back to school? What should we be thinking about in terms of illnesses and also precautions that we should follow?
Yeah, so there's some important things that parents can do to help keep their kids healthy and in school, ready to learn, making sure that kids are having a good routine when they go to bed, when they wake up, getting enough sleep, having time for homework and a consistent meal time. Also that healthy nutrition, so healthy snacks, breakfast before school, drinking plenty of water, things like that. Staying up to date with wellness visits with your healthcare provider, even things like getting eyes checked and making sure you're seeing the dentist, and staying up to date on those immunizations like we talked about are going to help prevent disease. Hand washing, something so simple but so important. 20 seconds, really good soap and water, especially with those little kids. Make sure you are modeling those good behaviors for them so that they can learn how to wash their hands on their own. All of those things are going to help keep kids healthy and boost their immune system and help decrease germs at school.
Wonderful. And you mentioned school nurses, you work one. I think it is important for parents, if they have any concerns, any issues, or if the child needs any particular attention, to make sure they're talking to the school nurse about it, right?
Absolutely, absolutely. The school nurses are wonderful resources for families, for school staff, and wonderful partners for us to work with.
Okay, so don't forget, our schools do have school nurses, and they're there for a reason, which is to prevent, protect, and provide to either students, parents, teachers, and staff. So every child at some point is going to get sick. Adults do, but children, as they're younger, we do know that they tend to get exposed to all of the things that they haven't had, and they're going to get sick. So what is the advice that we give parents when your child is sick?
Yeah, so a general rule of thumb would be if your child's not feeling well enough to participate in normal activities or has an illness that could be spread to other folks, it's a good idea to keep them home. There's some specific symptoms to watch for, so a fever that's 100.4 or above. If there's any vomiting or diarrhea, we'd want to make sure that kids are staying home and then are symptom-free for at least 24 hours without using any medication to reduce a fever or anything like that. So symptom-free for 24 hours before they come back. Also keeping in mind if kiddos have a new rash, especially if it comes with a fever, because that's a sign that it could be something contagious like measles or chickenpox. So if it's a new rash, making sure it's checked out by a healthcare provider. Also, if kiddos are having a persistent cough, persistent runny nose, sore throat, it might be time to get them checked out by a healthcare provider. And then there's those serious things like difficulty breathing or dehydration. Those would require immediate medical care, and we'd want folks to reach out to their healthcare provider. But also, anytime you're not sure, give your healthcare provider a call. Check in, send them a message on MyChart and see if they need to be seen.
Wonderful. Yeah, and today is pretty easy to get a hold of your provider. You can message, you can IM, you can text. I mean, there are a lot of they're all encrypted, of course, so protected. But there are many, many, many ways. And I know our providers do a good job in trying to get back to you as soon as possible. I'm a patient too, and I message my doctor, and I always get a response very quickly. But I think it is important to emphasize the fact that don't overlook if your child doesn't feel well and you don't know what it is. An ounce of prevention is worth 3 pounds of cure. So check with your provider, make sure that whatever your child is feeling is not contagious. We all occasionally feel a little bit out of sorts, and that's okay. But make sure you check. So a couple of things to remember from today. Like I said, we did have an exposure in the community, so we have to be mindful of that. Kids are going back to school, and it is important that they go back sleeping well, good nutrition, maybe not spending as much time on their cell phones. And I know that District 81 has done a great job of engaging in real life as opposed to being with your phone, and that's important for children. Talk to your school nurse if you have any questions, if you have any issues. If you're not sure what to do with measles, go to our website, and everything you need is there. Any last words of advice for parents, teachers, community as we go into the school year?
Do your best to continue supporting your kids. We know that parents and caregivers are excited for kids to go back to school, but a lot of times it can be nervous, excited energy from kids. So support them, give them grace, and try to encourage them to keep going to school. That's what we want them to do, to be in school to learn.
Wonderful. And remember, school is not just about academic pursuit. School, K through 12, is a time for development. It's a time when we build friendships. It's a time when we learn. Sometimes we meet someone that inspires us. So with that, I want to say thank you to Jenni and our whole team upstairs. And if you go to our website, there's some information about some community-based MMR immunization clinics that are coming up, so keep an eye out for that. We'll say thank you to our teachers and all of our faculty. Thank you to our parents, and let's hope that this is going to be a wonderful school year, and we're going to have lots of fun, learn a lot, and keep disease under control. Don't forget to wash your hands. With that, stay safe, stay well, and we'll see you again next week. Have a great day. Thank you.